like the green light thing, so if you continue to work with them and the educator and everything, they'll give you a green light. And it's a high, like statistically speaking, it's a high chance that you'll pass NCLEX if you get that green light from them. And then if you don't pass, your time with ATI won't expire and they'll continue to work with you to get you prepared. So one of the benefits of it, continue to work with you.
Are these things like the assessments where it's like on a lockdown?
Yeah, it should be, yeah.
So like it's just like capstone, but
Similar, yeah, yeah, and then some of the like, stuff that they'll have you do, like some of the modules, I know like last year when I was working, like last semester working with the seniors, that some of it's just like the nurse logic and those things, those are things within ATI, like modules that you've had access to. Same with like some of the, like they'll take you into some of the modules, like fundamentals, like engage fundamentals, things like that, after the assessment for those individualized assignments.
so do we not get the points unless we get the green light?
No, the green light, you won't, get the green light unless you do like all of it. So you're just doing those 4 modules that are listed on the policy. So you have the ATI tab on Blackboard. And so it's the, nurse logic and, the other NCLEX prep resources to help with test taking skills, the fundamentals, pharmacology and med surge. So we're gonna do fundamentals, pharmacology and med surge for like the 3 major content areas for nursing. And then, you can continue to work on it, say you get this stuff done within the next couple of weeks, you can continue to work on it, but no, you don't have to have the green light in order to
Just
like,
have to have
get the
those
points,
done.
get those 4 done, yep. So 10 points per module.
Sorry, is the nurse logic, is that under NCLEX readiness or?
No, that's just like in your ATI modules.
Yeah,
Where
so
it's
like the prep,
like
So
not,
So it's not,
yeah, so
not
if you go to
an
ATI, yeah, if you just go to like ATI, and then it's just where we do all of our assignments for like this class.
like, yeah, if you go to, like, yeah, if you're on ATI, if you go to, like, your, my ATI, should be one of the first things you see.
Where is the,
Yeah, it's just in those.
or
No,
just
not
something?
in
Yeah, just in those, yeah, and you can always search like nurse logic too, if you want to. But yeah, it's in there listed, yeah, so nurse logic right there.
Oh, perfect.
So since there's 4, I'm gonna just do all 4 of those.
So.
Yeah,
it's
Okay.
yep, go through and do those, yep.
Gotta do all of them.
do we spend an hour on those?
There's like no time requirement or anything
For
like
those
that,
ones, okay.
yeah. Yep.
So it's just all of these modules?
For the nurse logic
The
stuff.
4 that's underneath that?
Yep.
Okay.
Do we have to screenshot it and send it to you, or?
No, I have access to everything that you guys do on
Okay, so we
ATI,
don't
so I'm
have to
able to
turn
see.
in.
No, I'm able to see like your scores, the time you spend on things for Nurse Logic, and then also for VATI. I'm able to like we'll get weekly reports that I'm able to see your guys' progress on that.
Should we all have access to Nurse Logic? Is it Nurse Logic 2.0?
Yeah, yep.
So there's like
That's it.
4 in there.
That's cute.
I already took one, it looks like.
Yeah, same.
I've done some for other classes. What other questions do you guys have about?
Did you say how, like what we have to get on the test?
No.
It doesn't.
Nope.
Just whatever.
Yep. Yeah, and like, yeah, with the Nurse Logic stuff, yeah, just doing that, and then the other, ATI stuff, you'll do the assessment, then you'll get assignments from your educator, and then just working through those with your educator. Anything else right now?
So this is still like a month out, but the webinar thing that's like all day, is that like literally all day?
Yeah, that's my understanding, that they have like engaged in like activities and things like that for NCLEX prep.
Okay,
Mm-hmm.
it's just, it's a lot.
Yeah.
Lots of
My
energy
brain's
drinks
gonna
that
be
day.
We tried, to get a live review, but of course you have to have 10 or more students. Like, why can't we just, we're one away, like, why does that matter? Like, why can't we? So we worked really hard with them to try to get you guys to be able to have the, live one, so.
So all this baddie stuff is due on like the Monday or the Wednesday? last week?
Just have it done, try to have it done like that, like Friday of week 15, just so it gives the ATI educators time to grade your stuff, so then we can get the points in and everything.
Sorry, Mom.
What other questions do we have?
Okay. Obviously, like, it's up to us on our own, like, timing, but what would you recommend, like, breakdown of how to do this timing-wise, like, week by week, or?
For like the modules and stuff, yeah, maybe like kinda like capstone, you can do it week by week,
Okay.
yeah.
Just
Or-
so we're not, like, rushing it too much,
Yeah.
or?
Yeah, I would say just, yeah, go ahead and start it this week and do it week by week, because then if there's 4, I mean, we're on week 11, that gives you, you know, still like 4 to 5 weeks to get stuff done, yeah,
Okay.
4.5 to get everything done, so yeah, I would just do like, yeah, week by week, if you happen to get it done with like NURS Logic pretty quickly this week, you can go ahead and start on like the fundamentals, next one, and work through it, yeah. And then just doing like NCLEX questions, which is, they'll have you do some prep and stuff like that there, just cause practicing NCLEX questions is very important. Working on that exam endurance, so that you're prepared to be able to sit there and take that number of questions, so. Did you have a question, Bailey?
Is there like a lot of modules within all these, like the VATI?
So it depends on like your assessment and what your, ATI educator assigns you based on those assessments.
Okay.
So yeah, it'll vary. So again, like those assessments is just to help identify our gap areas, since we all have them and will always have them, and then you'll focus, on that. Like for me, like with like adult health and everything, like neuro, I know that's one of my weaknesses, it's one of my gap areas. Whenever I teach neuro, I have to like refresh on it every time, because for whatever reason, it just does not stick as well with me.
So for
So
the
you
nurse
did it, right?
logic thing, since,
Yeah.
Unless it's diabetes or thyroid.
for the nurse logic thing, since we've already done one, do we have to redo it?
No, it's fine if you don't redo it.
All is not available yet.
I think you have to do the orientation first.
Yeah, so do the orientation and then it will pop up for you. And I'll kind of walk you through some of that. What other questions do we have? Okay. So today we will cover our last content for this class. So your exam next Monday is going to be over like, care models, quality improvement, information technology, and then disaster preparedness. So I know in community health, you guys also learn disaster preparedness. Have you done that yet, or is that upcoming?
That's upcoming.
Upcoming, okay. So you guys are gonna be prepared for that. You'll be set to go here. So we'll talk about, like our role as nurses for disaster preparedness, and then we'll walk through some triage, because triage for disaster preparedness is going to be different than your triage for like when you're in the emergency room. Since you know, like emergency room, like nursing, things like that, we are wanting to save everyone or attempt to save everyone. So disasters, what are some disasters that we might encounter? Tornado, so just, so last year, or the year before, the tornado in Winterset, can't remember now, time's kind of a blur, like that was a bad one. And then what else could we encounter, that's disaster? Floods, yeah, I said floods at first, I'm like, so yeah, floods. Yep, so floods are another one that we can encounter. What else? So those are natural ones, so natural, disasters that we might encounter. Like shootings, yep, so shootings is another one. So kind of natural, we think of like our floods, tornadoes, like things that we see here, you know, the derechos. But you know, if you're on the coast, you can have the hurricanes, fires. So kind of thinking of those natural disasters, earthquakes. I know recently there was another big earthquake in another country. But yeah, then we can have shootings. That's why back there, you know, we have a GB emergency response if there were to be an active shooter on campus. It makes me laugh because it's, the acronym is ALICE, so I'm like, yes, I definitely associate violence with ALICE, so So the active shooters, could, depending on the situation, be considered a form of terrorism. What are other like acts of terrorism?
Bombings.
Bombings,
Bioterrorism.
bioterrorism. What are examples of bioterrorism? Cause you can have like, the bombings, you can have, like 9/11 as an example, shootings, things like that for terrorism. What is bioterrorism? Anthrax, yeah. Yep, so using those different chemicals or biological agents. So anthrax is one, I know I can't remember when it was, but like if there was, the scare of anthrax being sent through the mail. Smallpox, TB. Those are the biological ones. Chemical is gonna be like Agent Orange. So chemicals that we have like cyanide, chlorine gas. And then other, like mass casualty events or disasters that can happen would be like a plane crash. There can be like a multi-vehicle accident where people are having to respond to the scene. So through the American Cross, you can actually become like certified. You can take like a disaster preparedness class and become certified. And so then you can work with the Red Cross and be able to respond to these if that's something that you're interested in doing. But as nurses, what is our role when it comes to disaster preparedness?
Save as many people as we can.
Save as many people as we can. Remembering that we have limited resources, so we're not gonna be able to save everyone. And we'll kind of talk through the disaster triage. Utilitarianism, yeah. Definition. So we also wanna think about like preparedness. Because we don't want to have stuff be reactionary. We need to be prepared. So how can we help our communities be prepared for disasters? So like here, what are things that we need to worry about in Iowa? Tornadoes.
So like shelters to go to.
Yep, shelters to go to if you don't have a basement. So, or even if you don't have a basement, like, or is a safe place in your house that you can go to. Like other disasters, another one we forgot to mention, fire. There's like a big, we mentioned like forest fires, but if there's, your house catches on fire, and you have lots of people in your house. And here, like, had a couple derechos now, and then also can be flooding where we're at. So yeah, so tornado, where to go. What else should we be kind of educating people on? We're thinking of preparedness. Plans, action plans. Evacuation plans, action plans. So, tornado, goes through a town. What does that do to the town? We all love to have these and communicate with these. Is this necessarily gonna work? No, depending on what it takes down. If it takes down those cell towers or things like that, it's not gonna work. So what should be included in those action plans that you can educate them on?
There's a lot that can be included. It can be like stockpiling supplies, making sure you have family members who also know your action plan. I don't know.
Yeah, so like,
Communication wise, like what.
so a lot of times what they say is if you're gonna be like separated or something happens, have a meeting point. So know that everyone's going to meet at this point, at this spot, so that you can find each other. So Alice, they had fire safety in kindergarten the other week, and so now she's asking a lot about fires, and like, what do we do if there's a fire? Like, will you get us out? We're like, well, yeah, like, we'll get you guys out, like, but we're like, if you happen to get out on your own, like, we have now pinpointed, we work together and found a spot, like, this is where we will meet. If there's ever a fire and you get out of the house, we will meet here. So kind of having that plan of where to meet. So having that like evacuation meeting plan, stockpiling, so making sure you have flashlights, batteries, jugged water, because, you know, you don't know how long the water can be out. Especially when we think about the derecho that hit in 2020, there's a lot of people that were without electricity for a long time, and even for months after, like over in like Cedar Rapids and stuff like that, certain areas, they didn't have water for the longest time, so kind of stockpiling water. Medications, you need to make sure that, you know, you have plenty of medications. I know insurance, you can only have so many at a time, but just make sure you could always keep a little bit like in that, with your, pile, with your area of stuff that you're gonna have. So just knowing what we can do for that. And so then like, being prepared, you know, for like disease outbreak, were we prepared for COVID at all? No, like that was just a crap storm. Like it was like, we really saw all the flaws in our system there. So as much like notice as we had, as we were seeing things coming from other countries, we were not prepared at all. So for one of the IPE events, we used to do like a mass casualty event that was like an outbreak of, I can't remember what disease now, but then we're like, I don't think we need to do this one anymore because we've all lived this one. We've seen that response. So, you know, changed it now for that as we're going through. So we're gonna try to do, you know, the prevention and mitigation, but making sure then that we're prepared. When you're in the hospital and working, you might have mass casualty drills that you are doing. So I'd have to do those in the emergency room. They'd kind of set up and like be like, okay, this is what you have, what are you guys gonna do? You know, we'd have to go through the triage and kind of what we would do with our clients within the emergency room. So, you know, you're a nurse on the floor, you're the nurse manager, and they call and they say that we have mass casualty going on, or like multi-vehicle accident. And we need to see these people. What's your role as like the nurse or the nurse manager? It's like either in the emergency room or on the floor.
Making sure beds are cleared.
Making sure beds are clear. So what are you gonna be doing with your patients?
Prioritizing.
Yeah, we're gonna be prioritizing. Yeah, so you're gonna be looking, you're gonna be like, is this person stable enough to like be discharged? Is it someone that's in the ICU, and are they stable enough to be transferred to the unit? So kind of reallocating like those beds, like moving people around, so we have those resources that we need openly available to us here. Pull it here. So yeah, triage, as we're going through it, like I said, it's going to be a little bit different, just because we aren't going to be able to save everyone. So we are going to be making decisions that make the greatest benefit for the greatest amount of people. So remembering that we only have finite resources. So we're not necessarily going to be using those resources to bring back someone that's either dead or is expected to die like very soon based on their injuries here. So it's called like the START triage, so simple and rapid triage here. So our black, what's our black gonna be, our black clients? Deceased or like expected to be, die if they don't receive extensive resources. So again, that's different than like the triage that we've been taught, because like if someone's, you know, dead or very close to dying, we would take them right back to the emergency room. So then you would just take them, black, and then you would move on. So then green, we have people who have minor injuries. They're able to stand and walk around, so they're like our walking wounded. So if they don't get interventions, they can go days without having interventions and not really gonna have any complications. And then yellow, it's gonna be for people who require intervention, but it can be delayed for a few hours because it's not expected to worsen. And then red, people who have life-threatening injuries and need immediate intervention to survive. And so so we have an algorithm that we walk through. So I think the most important thing to know, like with disaster preparedness and disaster training, you will be assigned a role by like a leader. So whether it's triaging or maybe you're taking patients as they arrive type of thing. So you'll be assigned a specific role if you were here. So as we're looking, we have an algorithm that we can go through here, which is nice because it makes it easy to quickly make those decisions here. So here I have some patient or client scenarios that we're gonna walk through, and then working with the algorithm, we can figure out what we would triage them for. And then I'll also post, like as I was playing around last week, there is an actual website that you can go through, and it gives you different scenarios and you can walk through, and it's more like a kind of a simulation type of thing, so it can give you more practice. I thought this would be good. It's timed, so you have to go like quickly and think quickly, so I thought it'd be best to kind of walk through scenarios this way, and then you guys can work through things there. So as of right now, like what questions do you have about like disaster preparedness? Alright, so here we have patient one. They're apneic, pulseless, and missing their left upper extremity. What are we gonna do for them? Black tag, okay. Are we gonna, yeah, if we follow the algorithm, sorry, I was thinking of something else. So are we gonna, if we follow that, algorithm, so we have, you know, like their, spontaneous breathing, we have no. So what you're always gonna wanna do is reposition that airway to see if that opening of their airway. And then if they remain apneic, we're gonna black tag them. But then if they started having spontaneous breathing, then we would work our way through the algorithm there. So client number one would be an apneic, pulseless, and missing a left upper extremity. They are going to be expectant. We're gonna black tag them. So we put a black tag on them, we move on. Patient number two, eviscerated bowel, multiple penetrating wounds to chest and head, brain matter exposed, unresponsive to tactile stimuli. What do you think?
It's another black tag.
Black tag, and why?
They've got brains everywhere.
Yeah.
Got brains everywhere.
Yeah.
Mm-hmm. Let's see if this will work. Sometimes this works and sometimes it doesn't, so we can pull stuff up. And this is, yeah, on. I just wanna make sure it's not upside down for you guys. There we go, that makes it easier for you guys to see. Okay, let's see if I can. Okay, so this one, we have the brain matter exposed here. So that is what is going to make it be the black tick here.
I don't know if I could do that.
Having to make those decisions.
I mean, the other three colors, but I don't know if I can black tag people. That'd be really difficult for me.
Mm-hmm. That would be hard.
Especially if they're still kind of alive, and then you just black out and like walk away.
But if that's the last thing they see is you put a black
Let's
tag.
take it and walk
Yeah.
away. I mean, if they have brain matter exposed, I mean, they're unresponsive, so they're not. One second.
You know, you wanna stay with someone who's dying too.
Mm-hmm. And like, yeah, you're not necessarily able to, unless you could just find a bystander to be there with them, type of thing. Okay, so that one would be black.
Green,
Green, okay. What makes you say green?
cause they're able to walk.
Able to walk?
They're,
Mhm.
yeah, and they're alert and oriented.
Yep, so walking moving, so pretty much if they're up and walking and talking, of course you'll do like a quick, assessment on them, but the walking moving, so essentially if you're awake, walking and talking, we're just gonna put you as a green. Okay. Next, we have here. So multiple penetrating injuries, blood in ears, responds only to pain, airway clear, respiratory rate 20, and strong radial pulse. And so you can kind of work through the algorithm too. It's on ATI, so they're breathing, so we have spontaneous breathing. Look at their respiratory rate, is it greater than 30 or less than 30?
Would be a red tag.
You red tag? So it took you to red tag.
Cause they're not able to walk.
Okay.
They're breathing,
Mm-hmm.
pretty clear, but then their respiratory rate is under 30.
Yeah.
So it would be immediate assistance.
So if it's under 30, if we're looking,
Oh,
then we move down to perfusion, looking at that. And then airways clear, they have a strong radial pulse. And then mental status responds only to pain. So if we go, continue down, mental status, yeah, responds only to pain, so that they're obeying commands if they're only responding to pain. What's your thoughts? So we're between delayed yellow or immediate red, what do you guys think?
I would say red.
Red, I would agree with that, why do you guys think red?
They're only responding to pain,
Mm-hmm.
they can't respond to their commands,
Mhm. That's what's nice with having this algorithm, because it's like, okay, yeah, their respiratory rate's good, perfusion seems good if they have strong radial pulses. But then we get to the mental status, and that can change us again to be yellow or red. Extremity fractures, blood in ears, awake, alert, and oriented times 3, and respiratory rate of 26 with strong radial pulse. What do you guys think? So what are you going back and forth between here?
like yellow.
Yellow?
Like the blood in the ears could also be like a red. I feel like, I don't know.
Mm-hmm. So we're kind of walking through that algorithm. So they're breathing, yes. What's their respiratory rate? Is it greater than 30, less than 30?
Yes.
Less than 30. Perfusion seems to be good since we have a strong radial pulse. Then we're going down to mental status. Are they obeying commands or not obeying commands?
Probably obeying.
Obeying commands, so what would that make them then?
Yellow.
Yellow. Okay, so number 6, child screaming, has minor lax, blood in ears, respiratory rate 30, moving all extremities. What do we think for this child? So it's a little bit different if we're having children, so we have like a jump start that's also listed here. So we have spontaneous breathing. So our respiratory rate for our kids, if we're looking at it, we're gonna become immediate if we're less than 15 or greater than 45. So if we're between 15 and 45, we have
so yellow.
yellow. What got you the yellow?
Their breathing's okay,
Mm-hmm.
somewhat conscious.
Yeah.
I think,
moving,
and screaming, so.
yeah, screaming, so we know that they're able to breathe. The only thing I don't like about this scenario is like, I feel like it could be dependent on the age too. Like, is it like a 5-year-old and they're up and walking around crying and screaming? Cause that could change things, you know, cause it could be green then. But then, you know, if it's an infant, you know, just then determining is this person able to walk or not? Or is it just them moving all extremities showing that they're fine? So like this will be one, yeah, it could be like yellow.
So is it based on like really who the, like the person is that's doing the triaging?
It shouldn't be.
Well, because when we did the mass casualty
Mhm.
event, like, there was a lot of them that was like between 2,
Mm-hmm.
but then they never told us the answer.
Oh, okay.
So it was like left to our imagination.
To figure it out. So that's where this like algorithm comes in really handy. If you're gonna be the one that's doing the triage, you can have like the start and the jump start available to you. You know, so hopefully when you're on site, they would be able to hand you like a laminated card that you could just walk through quickly and be able to just follow that algorithm. Cause if you're following the algorithm, it's gonna make that like decision making a lot easier for you.
So do we get this ATI thing for our test?
No, not for the test, but yeah.
So is blood in ears a distractor, cause it's not in the algorithm?
Yeah, it would be like a distractor, so kind of like having to think about, is it something that's going on that could be neurological? Or is it just with, you know, is it like a bomb explosion or something like that that caused some like, just like eardrum injury type of thing?
Do eardrums bleed?
Yeah, so if they have people like in bombings and things like that, they'll have blood coming out, they can have blood coming out of their ears and injuries there. They like, yeah, rupture and things like that.
So that shouldn't be like a scare sign, like immediately get them into the.
No, cause it could be, if they weren't, you know, responsive or following commands, then yeah, it'd be more immediate, cause that could show signs of a neuro issue going on, like a brain issue. Does that kinda help clarify it? So here we have patient 7, we have amputated fingers, head injury, awake and alert, oriented ×3, dizzy, respiratory rate of 24, and smells like beer. So we're kind of walking through our algorithm. We have spontaneous breathing, respiratory rate is good. So then we don't have our cap refill on here. What do you guys think just with this information that we have? And honestly, you can't really assess cap refill on one hand if we have amputated fingers.
I think it'd be yellow.
Yellow? And what makes you guys think yellow here?
It's like alert and oriented,
Mm-hmm.
but also he's dizzy after a head injury.
Mm-hmm. Yep, yeah, cause he's, following commands, things like that, if he's awake, alert, and oriented.
And you could stop the bleed on fingers, not a whole arm.
Yeah.
But like fingers you could.
Mm-hmm. So it doesn't need like the immediate, so he'll be fine for a few hours. Mm-hmm. That's good. And so yellow. I feel like it's, you know, with like in classic NCLEX type stuff, it's like either it's obvious that they're black, it's obvious that they're green, but then it's just differentiating between the red and the yellow here. So chest pain, shortness of breath, no trauma noted, respiratory rate 34, and shallow, weak radial pulses. So spontaneous breathing, respiratory rate is over 34. What does that automatically put us at? Red. And then also we have the weak radial pulse. So that is an easy red there. Let's see, 10, some penetrating trauma, unresponsive, apneic, no radial pulse. Carotid pulse is 130 over 130 per minute.
Isn't apneic like already black?
So we have to reposition their airway. So that's what, remember, no, is that first step is repositioning their airway. So if you go up their apneic, reposition, like this person has a pulse. So we reposition their airway, see if they have spontaneous breathing, and if not, if they do, then we'd follow along, become red. But then if they don't, or if it's, don't, then it would be expectant. So like this, reposition airway, they're still not breathing, they remain apneic, they would be, black tag, expectant. Like we wouldn't do anything for them, even if they have a pulse. So again, it's just a different way of thinking compared to like what we are used to for like triage and prioritization. So this person we would, start with the black tag and then leave them.
So if it says apneic, should we already assume that we reposition their airway?
Yeah, or it might say, you know, like, what's your, like, you know, next step, or like priority assessment, priority step, or like if that information would be included in the question, that like, yeah, apneic, after reposition airway type thing. Yeah. That's why, like, yeah, I'll post that link for that, the like kind of simulations. It has one that's like a school shooting, one that's a fire, and one that was tornado, I think. So they're good to go through. Like it was kind of like a challenge, like a race to try to get it, because like every time you do like an assessment, it takes off time. So you have like 10 minutes to get through the scenario type thing. So I'll post that for you guys to do kind of for more practice, and it will give you information and yeah, like a virtual simulation thing. So here we have an arterial bleed from the leg, responsive to pain, respiratory rate 34, no radial pulse, and carotid at 130 a minute. What do we think for this one? Red. Why do you think red?
His respirations are over 30.
Over 30, no radial pulse. So yeah, a couple things there that make it red automatically. So then, yeah, we could do a tourniquet on them, and then like get them, people would come and get them if they're red, or we could take them to continue on getting care. Here we have minor lax, crying, ambulatory, respiratory rate of 24. So is this a walking wounded? So what would that make them? Green. Yep. Here's how to walk through. Patient 13, deviated trachea, respiratory rate of 40, weak radial pulse, positive jugular vein distension, and cyanosis. What do you guys think? Red. And why do you think red?
Respiratory rate above 30.
Mm-hmm.
He has a pulse.
Like a weak radial pulse. So yeah, those two things alone, yeah, would make them automatically a red. Do their red tag, and then they would take them from there. And kind of like some places will set up actual like triage sites, so they'll be bringing the victims in, and then you're just right there and taking them. And so then depending on what they get tagged as, then they'll be like, you know, transported to a hospital or given more additional resources there. Like the paramedics could take over and take care of them there. Patient 14, open fracture of right upper extremity, non-ambulatory, awake and alert and oriented ×3, respiratory rate 26, and a strong radial pulse. What do you guys think? Yellow. You guys have the algorithm already memorized. Look at you guys go. A few more here. Chest pain, shortness of breath, slurred speech, right-sided weakness, awake and oriented ×1, respiratory rate 24, strong radial pulses here. What do you think? This is kind of a gray one right now.
It's hard. My gut wants to go with red, but the algorithm, I'm looking at yellow.
This one's hard because yeah, you're following the algorithm and you have yellow, but then also like chest pain and shortness of breath. Like what do we automatically think? Chest pain, shortness of breath. What was that? Heart attack, which needs immediate intervention. So yeah, for me, like yeah, I would probably do this one as a red just because of the chest pain, shortness of breath, automatically thinking heart attack. Could be, you know, the stress of everything causing them to have a heart attack.
So if the chest pain and shortness of breath wasn't there, cause like the A&O is only ×1,
Yeah.
so like I don't know.
Oh yeah, that's a good point. I didn't even look at
Yeah,
that.
that's
I didn't even think, yeah, you're right. That would make it red alone
Yeah,
there.
okay.
Yeah, yeah. like read that, but I wasn't like comprehending, then I'm like, oh, that means that they wouldn't be following commands, that they'd be confused, so you're right, thank you for pointing that out. So yeah, that would automatically make it a red as well. An avulsion of the right upper extremity, an arterial bleed, awake, and oriented times 2, prayer rate 30, and saying, I am thirsty. What do you guys think?
Yellow.
Maybe yellow? Why do you think yellow?
Feels like he's kind of alert and oriented.
Mhm.
He's talking.
Okay,
It's bleeding out though,
Yeah.
pretty fast.
so if he has an arterial bleed, could we leave this person, for a few hours and they'd be fine? No. So that would make them a red for looking at that heart bleed, cause they would need immediate intervention to stop that bleed, so we could, mark them as red, have tourniquet on them, transport them, yeah. Kimberly?
What's an avulsion?
Okay, so you guys, remember an avulsion? That is from like med-surg? Okay, let's look it up.
I was gonna Google.
Glad it wasn't just me.
See, exposure to more things, yep, so an avulsion.
Ooh. The action of pulling or tearing away.
Oh, so their arm's missing.
It'd be like a fracture too, it's not necessarily like
Oh, okay.
an amputation, yeah.
Oh, when a bone fragment separates from the rest of the bone? Okay.
So it's a type of fracture, so you have like the compound, like, yeah, so just kind of remembering all those types of fractures.
You know, it's an arterial bleed because it's like bright red and pulsing or something.
Yeah, like kinda, yeah, the shooting out, like, yeah, location of that bleed and, yep.
Did you see this picture?
You have a good picture of an avulsion?
It's like his, oh, there we go, his finger.
Doesn't want any type of bad fracture ever, like, oh, yeah, yeah.
Oh.
I always think like degloving injuries too, I'm always
Yeah,
like,
that's what it is.
or the degloving, like, oh, that just looks, Got two more here, and so open fractures to the bilateral lower extremities, blood in the ears, awake and oriented times 3. Respiratory rate 28, strong radial pulse, what do we think?
Yellow.
Yellow, yep, following our algorithm yellow. Following commands, respiratory rate's less than 30, we have a strong radial pulse. Very good. And the last one here, I have historical screaming, blood in ears, awake and oriented times 3. Respiratory rate 36, strong radial pulse, what do we think? Just kind of, what are you guys going back and forth between here on this one?
I feel like this one we need to know the age.
The age, what if I said that they were 19?
Well, with the respiratory rate, it's supposed to be red.
Mm-hmm. Yeah, so technically, yeah, with their respiratory rate, it would be red. If you're going through that, then also, if you're hysterical and screaming, that would be, it's gonna raise their respiratory rate too, so. Just let you know for exams, they're not gonna be gray, like, just so you guys know. They're not gonna be gray areas like this one. And then, yeah, like if this one was like walking around, like if you assess that they were walking around and screaming hysterically, and like that would just kind of be an automatic green there too. Was it when we did this last semester, we talked about like, yeah, having like some that were between like a red and a yellow, like, can we make them orange? Like, can they be orange? Like, can we add our own color here? Yeah. So kind of walking through these scenarios kind of help some. So I'll post the links to that simulation that I talked about where you can actually go through and work on things to go through them. It's good, like I mean, not that it's like fun to have to think that way, but it was like kind of more of like a game too, because you're kind of working with the clock here. So that made it more interesting. Okay. And then I'll also post another link that kind of has one that is showing, and it was interesting because it was going through, kind of shows what like, if someone arrives, like the scenario is I think like a plane crash. And so it shows how things would be set up, like the different tents and everything, so you can kind of like go through, it's interactive as well, and you can go through like the, videos too, and kind of they'll talk about it, so you can see how things would be set up off-site. So all of this would be happening off-site, and then people would be being brought into the hospital to you. So just your role is dependent on where you're at for it. Any other questions about anything? This is our last content.
So a question, but it's not about this.